Hello friends, I am Dr. Anubhav Gupta and I am a consultant plastic surgeon working at Sir Gangaram Hospital. Today I am going to talk about a very common condition, which is the treatment and surgical treatment of age-related changes in the face, or surgical facial rejuvenation. Now, as we are all aware that as we grow old, the changes in the skin like wrinkles and depressions and sagging of skin starts appearing. Many creams have been advised, a lot of people use creams, but today I'm going to talk about the surgical part, which involves that there are many procedures which we can do which can actually make the skin tighter and make the person look younger. These procedures are like facelift, fat grafting, neck lift, then forehead lift, brow lift, then blepharoplasty. All these procedures are there is a combination of these procedures which you use to maybe knock off 10 to 15 years of age from a person's age. Now the question which comes to us is, what exactly are these procedures? Basically what happens as we grow old is that there are 2 or 3 changes which take place in the skin of our face as well as the underlying tissues of our face. The skin becomes loose and it starts sagging, that is number 1. Then there is some redistribution of fat because of the laxity of various ligaments which are holding the fat. So the fat also starts sagging. So these are the 2 major changes which take place. Now the premise of these procedures which we do is, number 1 is we remove the excess skin. For example, if there's a loose skin, we tighten the skin and we remove the excess skin, which is a common procedure called facelift. Now facelift can be a conventional full facelift, then there is a mid facelift, there is a partial mini facelift. So there are so many types of facelifts are there. Then there are procedures like for lax skin, there is a neck lift. Similarly, lax forehead, we have forehead lift, and then eyelids for that we have blepharoplasty. So it is by judicious understanding and choice we decide which procedure to do in which patient. Now the next question which comes to our mind is, how early can the patient go back to join his work? Usually when we do these procedures, it takes 4 to 5 days for the swelling to subside, and usually by 7 to 10 days the person can go back to resume his or her work. Now finally, if you were to ask me for any tips of not letting us grow old and how we can prevent growing old, well, from a plastic surgeon's point of view, it's very difficult to reverse the process, because once it's started, we are aging, and so it's going to happen. The only thing which I feel and I strongly recommend is that sunlight is not good for your skin. So direct sunlight exposure should be avoided. Then, as the various naturopathies have described, plenty of water, wash your face number of times with mild soaps, and drink plenty of fluids and seasonal fruits. These are the simple basic things if we do, and avoiding sunlight, we can prevent damage to the skin. Thank you.